Okay, so this case is a little bit more of a sad case. This is, again, posted with permission of parents. This is Icee, and Icee is about 12 years old. I will warn you, there is a little bit of graphic content in this video, but Icee is a really good example of how important it is to sort of, be proactive as these guys get older, or if anything bad is going on or out of the ordinary. So Icee is actually having surgery today to remove both of his eyes. He had undiagnosed dry eye, and that allowed basically very, very severe ulcers and infection to develop in both eyes. And so when we saw Icee, he had what are called corneal melting or melting corneal ulcers, which means that the lack of tears allowed bacteria and debris to get into the eyes and then actually create very, very deep ulcers. And without the tears to flush things, it allowed bacteria to essentially get right into and through the surface of the cornea. And it resulted in essentially a rupture of the right eye ruptured about 36 hours ago, and the left eye is just about 98% of the way there. So this little sweetheart, unfortunately, mom did everything she knew how to do and came to see us, but unfortunately it was just too late. So if you guys notice, dry eye is very, very common. Dry eye is very, very common in older dogs, and so if you notice any sort of excessive discharge, or the eyes turning red, or pawing at the face, or wanting to rub the eye, along the carpet or the wall, it is absolutely essential that you guys get these guys into the vet so that we can actually take a look at them and see what's going on. It's a very, very quick test to see if they have dry eye. It's a little strip of paper that goes in each eye, and we measure the tear production in a minute, and it usually needs to be above, we like to say above 25 or so on the little strip. But unfortunately, this little one came to us, and the end result now at this point is that things are too far gone, and he is in a lot of pain. So he does have a lot of pain meds on board. He's just about to have surgery. He has a fentanyl patch on. He's been given oxymorphone for pain, as well as anti-inflammatories, and we are going to remove both eyes. He has lost vision in both eyes because of this, and so he's going to be so much more comfortable post-surgery. He also has some bad teeth that we're going to address and make him feel a lot better. So he's getting what's called pre-oxygenated, which is something we'll do very commonly when they're about to be induced with propofol or propofol and Versed, midazolam, which is Versed, which is used in people again. Very similar, anesthesia protocols. We're really anti-ketamine because we don't feel like they wake up very well or quickly. So this little guy's getting pre-oxygenated. We're going to do surgery. We're going to remove both eyes, and we will place basically soaked sponges in the eyes that are absorbable, with also pain medication that's delayed release, so that he's very comfortable post-surgery. And post-surgery he will be on a fentanyl lidocaine drip so that he is comfortable for the next 24 hours. It's very, very sad that it got to this, but I think it's very important that if other people can benefit from this knowledge in terms of, recognizing that something's going on, I think it's very important that people be able to come into the vet ASAP and let us know, that they need something checked out. So redness, squinting, excessive drainage, mucus, especially green thick mucus, pawing at the eye, rubbing the face, having it be itchy, any of those are things that can be indicators of underlying low tear production, inflammation in the eye, ulcer, or early glaucoma. So please get those checked out ASAP. We're gonna get working on this little one, and then, you know, get him feeling better. All right, thanks guys. We'll talk to you soon.